Young Minds Matter is the second Australian child and adolescent survey of mental health and well-being. It's the biggest and most comprehensive survey of its kind ever conducted in Australia.
The aims of Young Minds Matter were to provide information on the number of children and adolescents who have mental disorders and mental health problems, the types of problems that children have, the impact that these problems have on children and their families, and also to look at the role of the health and the education sectors in providing help.
More than 100 experienced surveyors travelled to all parts of the country for the study. They interviewed 6,300 parents and carers with children between 4 and 17 years of age. They also asked 3,000 children over 11 to complete a questionnaire in private.
We want to know about mental health because it's such an enabler. People who are mentally healthy are able to make better friendships. They're able to participate socially, civically, and economically in the country. And very importantly, mentally healthy people have a wider choice that they can make in terms of the life that they live.
Young Minds Matter found 1 in 7 Australian children and adolescents had a mental health disorder in the past 12 months. That equates to 560,000 children. That prevalence has remained relatively stable since the first study was conducted. Fewer children and adolescents than 15 years ago now have ADHD and conduct disorder, but there has been an increase in the number of adolescents with major depressive disorder. There are substantially higher rates of mental disorder in families already facing other challenges, such as unemployment and family breakup. The highest prevalence of mental disorder were found in sole carer families where the carer was not in employment.
It was also really important to get information from young people about their own mental health, because a lot of the time their information didn't actually agree with their parents. They're not telling them what's going on. So that's really critical that we understand that.
When we asked young people about their own mental health, we found 1 in 13 11 to 17-year-olds met diagnostic criteria for major depressive disorder. For girls aged 16 to 17, that number was 1 in 5. 1 in 12 young people aged 12 to 17 had self-harmed in the past 12 months. For older girls, that number is much higher. The study also found 1 in 13 young people had seriously considered suicide in the past 12 months, and 1 in 40 had attempted suicide in that time frame. Again, when looking at girls in their late teens, the numbers were much higher. These estimates on self-harm and suicide may be conservative because some young people answered, "Prefer not to say."
That's been a troubling aspect of the findings. It's very well described in the report, and it's distressing to see the number of young people particularly that suffer from major depression and who also engage in self-harming and possibly suicidal behaviour.
The good news is rates of service use for children and adolescents with mental disorders have increased substantially. Now over half of young people with mental disorders are receiving some kind of help, and fewer families are dealing with problems on their own. Of those with severe disorders, most are getting help. Schools are frontline in identifying and providing help for children and adolescents with emotional and behavioural problems.
This survey has provided a wealth of information about the different types of professional and non-professional help that young people are receiving for their problems. It has also identified areas of unmet need. So as with the first survey, the information can be used to plan and provide services into the future, and particularly target areas of unmet need.